We will be working on the calf specimen. We will look at the superficial structures of the distal
limb first, and then we'll move on to the skin incisions, reflect the skin, and then work on the proximal forelimb, the extrinsic muscles, and we'll end by taking off the left limb. There are just two superficial structures that I want to point out on the distal forelimb for you, and those are the Dewclaws. So here's a Dewclaw, and there's a Dewclaw. So the Dewclaws there, and the Coronet. So we saw that in the pony as well, but it's the skin to hoof transition, or in this case skin to claw in the bovine. It's right here, it's the Coronet. For your skin incisions to reflect the skin off of your calf specimen, you'll start with a dorsal midline cut. So you're going right along the neck and the dorsal midline of the back here, and taking a cut horizontally, or vertically, I'm sorry, down behind the ear. So you'll have this halter that'll be kind of in the way. So just go as far cranial as you can and make your incision there. So right behind the halter. And for your caudal incision, the vertical one, go down about mid-thorax, all the way down. So you're doing this on both sides so that your cuts connect from left and right sides. And then you're taking a midline, ventral midline of the neck down here, and then encircling the forelimb. So you're going to, similar to what you did in the dog, you'll come down the forelimb, just distal to the elbow, which is right here, about 5 to 10 centimeters, come down and make a circular incision around the limb, creating that flap. And then you'll take the whole thing down, hopefully in one piece, and reflect your skin. So the calf has a little bit thicker skin than the pony, so you may have a little bit of a harder time making your incisions. But do the best you can. And take all of that down at once. And here, this muscle that you kind of see flapping is the cutaneous trunci. So you have the cutaneous trunci that will be adhered to the skin most likely. And if you want to just take it down with the skin, that's fine. You also have this Omo-brachialis portion that's over the shoulder here. We saw that in the pony as well. So you can reflect that caudally and then take all of the cutaneous trunci off as one piece and just reflect it distally there. All right, then we'll move on to some of your extrinsic muscles. So here on the calf, we have the Brachiochephalicus muscle right here. So here it's been cut in preparation for taking off that limb. But we also have the Omo-transversarius. So when you lift up the edge, caudal edge of Brachiochephalicus, you have Omo-transversarius here, which was actually different in the pony. So you want to make sure and see that in the calf. And right underneath that Omo-transversarius, in this view, you can see it really nicely, is the superficial cervical lymph node. It's this big oval-shaped lymph node. So that's also different than what we saw in the pony, so be sure and see that. Then we want to take a look at the pectorals, and so we're going to move to more of a cranial view for that. So this is more of a cranial view of the calf. So we're going from the front and looking at the pectorals. So we're looking at this pectoral region here, and what I want you to note first, and hopefully avoid cutting, is this cephalic vein coming down here. So hopefully you can see that. And then we're looking at the superficial pectorals in this region. So right here is the superficial pectorals, and you'll have two parts that you want to identify. The descending part is here, and the transverse portion is kind of underneath that and coming down under the forelimb here. So the descending superficial pectoral you can cut and reflect, and then you can see the extent of that transverse portion underneath. You'll also transect and reflect the transverse portion as well, and pull that out of the way so that underneath that, here I'll pull out the limb a little bit, and you can see the deep pectoral muscle. So here in the calf, we just have one part to that muscle, and that is the ascending deep pectoral. So this is all ascending deep pectoral going down the belly, but you see it coming up to the shoulder here. So ascending deep pectoral. And then we'll move on to a lateral view to look at the rest of the extrinsic muscles. So now we've moved to the lateral side. We're actually on the right side of the calf now, but this is a lateral view. So we'll go back over some of those extrinsic muscles that we covered on the other side because they're more intact on this side. So first we'll look at the Brachiocephalicus, which is this muscle going up the forelimb and up to the neck here. So Brachiocephalicus muscle. Then we've got Omo-transversarius coming across the shoulder area here. So Omo-transversarius going up underneath this Brachiocephalicus muscle. So we looked at those before. Then underneath that Omo-transversarius muscle, you have your superficial cervical lymph node. So you want to look for that. There's a big oval lymph node. And then we'll look at the ascending deep pectoral that we saw from that cranial view, but here we see it coming down the belly. So we saw it coming from the front, and then it comes down the belly. So this is all ascending deep pectoral here. Then we'll move on to trapezius. So your trapezius is kind of a triangular shaped muscle here, and it has two parts. So you have the cervical part here over the neck, and the thoracic part here going to the thorax. And what you want to do with that is make a big arching cut, like you did in the carnivore as well, and cut through both parts. So then you'll reflect those parts. So reflect that distally, and then reflect that up to the dorsal midline. And underneath the trapezius, you'll see the rhomboideus muscle. So here we've got rhomboideus, and we have a cervical part and a thoracic part to that as well. So we have cervical rhomboideus here going up the neck, and then the thoracic part of rhomboideus is here going to thoracic vertebrae. So you want to make sure and identify your latissimus dorsi and reflect it to completely see rhomboideus. So here you can see the edges of latissimus dorsi. And you want to make a cut just caudal to the forelimb here, vertical cut there, and then reflect your latissimus dorsi all the way up to the dorsal midline of the back. So make sure you reflect it far enough that you can see the extent of that rhomboideus muscle here. So you have that thoracic part that's kind of partially covered by latissimus dorsi. So thoracic rhomboideus and cervical rhomboideus. In this view, you can also see a little bit of the serratus ventralis muscle. So we have that here. You have that kind of serrated edge, the scalloped edge there that you see. That's the thoracic part of serratus ventralis. And then here you can see part of that serratus ventralis cervicis, so that cervical part of serratus ventralis there. Now we'll start removing the left forelimb by cutting through all of the extrinsic muscles. So you should have already made the cuts through the trapezius muscle here and the latissimus dorsi muscle there. So those cuts should already be done, and you reflect those muscles. You'll also want to, on the left side, cut through the rhomboideus muscle, so kind of an arching straight across cut here, so that you're following the edge of the scapula. So cut all the way through rhomboideus, both parts. And then we're also cutting through your Omo-transversarius, so that's here, right above this superficial cervical lymph node. And then your Brachiocephalicus muscle, you want to make sure you have at least a hand's width left so that you can identify it later, and that it's longer than your Omo-transversarius. So that's a good way to differentiate the two muscles once you've taken off the limb. So you want to transect Brachiocephalicus completely and reflect it. And then we're ready to take off the limb after we cut the pectorals. So you should have already cut through your superficial pectorals here. And then you're going to cut this ascending deep pectoral. So you're going to go right next to the sternum and cut it 2 to 3 centimeters away from the sternum and reflect that so that this ascending deep pectoral stays with the limb. So you'll want to make that cut. And then just as we did in the pony, you're going to start to lift the limb up and reflect it. So as you do that, you're going to have to cut through the vessels and nerves that enter the limb. So just come right underneath, and you should have already cut through your pectorals, and now you'll be cutting through all those vessels and nerves entering the limb, and keep lifting it up as you do that. And you just cut through the fascia, keeping the pectorals with the limb. And as you lift it up, it'll kind of pull away. And then eventually you'll get down to the point where you can see the serratus ventralis muscle, and then cut that away from the scapula. Oops. Then you should just be able to remove the whole left limb. Separate that out and bag it separately. And then here you can get a good look at that serratus ventralis muscle. So here you have that cervical part of serratus ventralis, and here you have that scalloped edge, that's the thoracic part of serratus ventralis.